Okay, I had a sip of coffee. I'm ready to go again and do the next next YouTube video for this lecture on an overview of COVID-19 and its effects on food and agriculture. I'm going to share my screen again, come back to these PowerPoint slides that also will be posted to eClass. So far, I've kind of taken you through how we're going to, COVID-19, the severity of it. One thing I didn't show you, so no, sorry, it's coming up. So we've kind of gone through, well, how do we know, how would we forecast the impacts of COVID-19? How are we learning the impacts of COVID-19 now? What was the situation in our world food situation as of early 2020, and what were some of the real vulnerabilities? Okay, I'm going to take you through sort of a way to summarize sort of the story about COVID-19 in food and agriculture, starting with a simplified food system. So here, and we're going to do this in a little bit more carefully next week and take more time, but for now, we have a situation of food supply and a relationship between the amount of food that a farmer or farmers in an area might produce and supply to the market in relation to the price. The higher the price that is available in the market, the more food someone and a group of farmers might supply. And that blue line traces out the overall relationship between price and quantity supplied. And so we call that a supply function or a supply curve. Okay. Then there is also, on the other side, there's a relationship between the quantity of food that a population may demand, or that population may be a single household, or we could think about a community or more at the global scale, some relationship between the price of food and the quantity demanded, such that the first law of demand, and we'll study this next week, first law of demand is that there's a negative relationship. So the higher the price, the lower the quantity demanded, right? So you have a fixed income, and if it costs more for an individual item, you're able to consume less of it. So we have these kind of regular relationships between quantity supplied and price being upward, quantity demanded and price being downward. And if we were thinking about, say, apples, and we just had an apple producer and an apple consumer, then we would look at how those two interact to see a market clearing price for apples, and that would be the amount of apples that would be supplied, the amount of apples that would be demanded. We would have a price, an equilibrium price for apples, and an equilibrium quantity in the market. However, we just need a little bit more, one more part of this to make it a bit more realistic, which is the fact that we have value addition. So we're not just thinking about apples that are just produced right next to a consumer. We think about apples are produced, people want apples somewhere else, and so there might be transportation that drives a cost of moving the apples around. There might also be, we might want highest quality apples, right? So there may be some of the apples which are wasted, which adds a cost, or we might want apple product like an apple jam or applesauce. We want to process the apple into some product, and overall we can think about a difference between a kind of a farm level production supply function in blue and a kind of a supply function to the consumer, which is in green, right? So then we've got kind of that margin between, a gap between, we might call the marketing margin, say for apples, and that always will hold for almost really any product other than a farmer's market situation. When someone is sent, drives to the farmer's market, this is what they're available to their farmer's market consumers, and you pay that price. So the equilibrium then that considers all of that then is given here. So we have the red, the quantity demanded, the demand function interacting with this consumer supply function, the green bar, and that gives us equilibrium price and equilibrium quantity. It also shows us the price which goes to the seller of the product, as well as the price that goes to the producer, the primary producer, which will be somewhat lower for that. So this supply chain tells us, can help us a lot to actually think through the effects of COVID-19. So this is a stylized, simplified version of that. So I'm going to trace through 5 impact pathways that are related to that. So we're going to talk about that affects some aspect or other of the supply chain. I'm going to talk about 2 direct consequences of COVID-19 as a disease. One is going to be on disease morbidity. So that's the sort of the reduction in your health and the productivity you can have because of ill health is morbidity, and disease mortality, people who die from COVID-19, right? So we have 2 types of real impacts of the disease itself, right? In a population, there is some level of sickness and people trying to recover from that. That's morbidity and economic loss of many things, including economic activity due to morbidity and loss of quality of life, and also due to mortality. Pathway 2 is the fact that COVID-19 affects food consumption, and through that affects, and as well as other eating habits, we'll talk about that in a minute, that affects nutrition, and nutrition itself also affects disease incidence, and nutrition affects the risk that if you get disease, the risk that you will have very severe effects or that you may pass away from the disease. So those are 2 direct consequences of COVID-19 we're going to trace through. There are indirect consequences, and I think we would say that COVID-19, that indirect consequences have been much larger than the direct effects as we're trying to control the disease. We go into things like economic lockdown. And that's, I think, quite different, say, than HIV/AIDS, where the direct effect would probably swamp the indirect effects. I think in this COVID-19 case, because of the susceptibility of every one of us to this viral disease, the indirect effect of the control measures, I think, have been much larger than the direct effect consequences of the disease. 3 indirect effects. One is due to lockdown and other changes. We have changes in people's income and purchasing power, drastic reductions in those. 4th pathway I want to think through is changes in mobility, and its effects on the food system, and so we'll get into that a bit more detail. And then policy responses. There's been a huge range of policy responses. I'm going to limit attention here to policy responses that are directly related to the food system. So going through these one by one, so I've got this boxes across the top of, in purple was the one that I'll be talking about. So here are these 5. I'm not going to go through these in next 5 or 6 slides. So direct morbidity and mortality, the number of cases keeps increasing every day. And it's large at the global level. I'm just going to show you in a minute what that numbers are. So this is something you might want to go to. I don't think this will work. So is check this ourworldindata.org/coronavirus. I invite you to go to that website, look at the data that is pulled together. So these are data primarily from Johns Hopkins that are then served in very, very appealing and dynamic ways by Our World in Data. And you can see how the number of cases has grown by each country. So I invite you to check it out and try to find Canada, trace Canada's cases over time, find China and its cases over time, but see also how cases rose gradually and then more recently, but quite quickly in a place like India. So India, we always worried back in March and April that a country like India was poised to have the very large effects. India had quite rapid and effective lockdown, big consequences for its population as a result of that lockdown. Just sort of the sheer desperation of people has meant that lockdown is less effective, perhaps now than it was. Cases have risen quickly, and now we have that situation of over 83,000 cases in a single day in India. So, we worried about that early on. It's coming to pass, and I think that will be more and more situations in more and more of the lower income countries, and in a way late for COVID to arrive in force. Some early lockdown keeps it at bay, lockdown relaxes, more and more cases accumulate. In the beginning, back in March, the highest prevalence was in the high income countries, which was an interesting situation. So there was this positive relationship between GDP, gross domestic product, and per capita and COVID prevalence. And there was a negative relationship with population density. So places with high income and high population density were the, so high income and low population density at higher rates, which was an intriguing thing. Recent studies then show that societies that have greater intergenerational interactions and denser social networks seem to be at higher risk. So that seems to describe the case of Italy. If you compare Italy to New Zealand, similar levels of income, maybe similar responses to the disease. In Italy, there are strong traditions of multi-generational families. So younger people who perhaps were carriers of disease, maybe were asymptomatic, did not show symptoms, were interacting routinely and closely with their parents and with their grandparents, and the grandparents were getting sick from those interactions with their kids. Strong social networks also in Italy. So that's had, for the lockdown then to try to get the disease under control really had large negative consequences for these multi-tier, multi-generational families in Italy. There have been many cases, we're seeing more and more evidence in the United States of how much the disease and its consequences are affecting African American, Native American, and Latino communities more severely than other communities for many reasons, some of which are due to chronic health problems that are in those populations, poor access to health care and primarily private care, and still in a situation of no universal health care, and lots of people holding on tight to the healthcare system they have, which privileges the few at the expense of the many. And then also these populations perhaps working in jobs that make them more exposed, not able to, say, work from their computers at their homes, working in the service sector, or being unemployed as a result of of COVID-19. So this is, there's more and more data about that. And here's an example of a paper that I pulled this from. It's an interesting disease in that fatality rate is so low among children, and really is as low as 0.2% for people under 40 years of age, while the fatality rate increases dramatically for people as they get older. So I'm kind of in the middle of that. So I'm in the 3.6% area. My mother is probably in the 20% fatality rate kind of zone, who lives in a long-term care facility. So when we have, thinking about the links to food and agriculture then, is when there are people who are sick and people who die, they aren't breadwinners. They also, because of lockdown methods that we've had to implement, older people are at greater risk and therefore have had to kind of withdraw from being caregivers, either paid or volunteer, for younger children. And so that might mean that you have greater healthcare expenses for families as a result of having to, not being able to have kind of grannies and grandpas looking after kids. And in many places, that's a very large effect. And so that's going to be a pretty case-specific effect, depending on the kind of the social structure of the community. Okay, so that's kind of our first thing of that first direct effect. Second direct effect is that poor quality diet is a major health risk. It's a major risk of the severity of COVID-19. So people with poor health status, so diet is a major cause of poor health, really the largest single group of causes of ill health, and this is measured in this disability adjusted life years, or DALYs, by the Global Burden of Disease studies. So they say that something like 22% of all of the death and 15% of the kind of the morbidity costs of all of diseases are due to ill health. Malnourished people are more likely to have ill health, and there's including more likely to experience severe symptoms from COVID-19. So both people who are undernourished and people who are obese are at greater risk of developing severe symptoms from COVID. They're more likely to contract COVID, is the finding from China from March. What we've seen, so I'm going to introduce to you increasingly some insights from the International Food Policy Research Institute, who's just published a book about COVID-19 and its effects on global food insecurity. They find strongly that the increased risk of food insecurity depends on economic development in across the world perspective. So when we have low levels of economic development, people are more or closer to the margin. There's some bump on that due to COVID, and more people are food insecure. And many of the employment options available to poor people are things in the service sector, which have been particularly affected, or the manufacturing sector, which have been affected by COVID and lockdown. And as that's happening, COVID is generating kind of greater gaps between rich and poor. And among the poor then, urban poor and women are especially vulnerable. So we think about cases like the situation in India, large numbers of poor people, large numbers of urban people, large numbers of urban women, poor people, sort of triple effect. Another interesting thing I just came across is that, a health effect might be that we are locked down, is that we're less exposed to vitamin D, which we get from being in sunny spots. So if we're staying inside more, we may have lower levels of vitamin D, which may itself be a health risk, worsening the effects of COVID. There is that this paper by Lanham, New et al. Also cautions about people taking copious amounts of vitamin D as a supplement in response to this. So you shouldn't overdo this. The second big point here is that it's likely that we have this direct effect of COVID-19 on people's health, but the indirect effect might be much, much larger in this case in terms of its effects, say, on child mortality. So as people are responding and taking actions to avoid COVID-19 and reduce the spread of the disease, many of those actions if they affect people, the health and nutrition of children, may have larger effects themselves. Those kind of avoidance behaviors may be exposing children to new health risks. It's estimated by the United Nations that 24 fragile states expect 5 million more children to be malnourished, partly because of the avoidance behavior, and that could include, say, mothers taking their kids to the clinic for healthcare for some other health risk, who don't go to the clinic because they worry about exposing their kid to COVID-19. Then we have kids who are malnourished, 9 times more likely to just die from preventable diseases. So sort of an additional, perhaps even greater effect than COVID-19. So while kids may be asymptomatic to COVID, they may be exposed to other diseases because of the risk avoiding behaviors of their parents. Okay, the third point I have here is about mobility. So COVID-19 behaviors is changing mobility of consumers. Consumers are eating out away from home less still, certainly much, much less initially in the early lockdown days. In a place like Canada, still fewer meals out of home, as there are restrictions, as well as people are self-moderating their behavior and eating more of their meals at home. Far fewer, so the income, that means loss of income for all the people in the food sector. So I think it was estimated there are 800,000 people in the Canadian kind of restaurant sector who are out of work due to the lockdowns. People are spending more money at home, more money for their meals they consume at home, much, much less for the meals they consume away from home. As they do that, they may be switching to more storable, less healthy convenience foods. If there's worried about can I get back to the store, then people stocking up on staples with long shelf lives. Without those things may be associated with higher levels of sugar, higher levels of salt, lower levels of nutrients. So there may be just kind of a deterioration in the quality of people's diets. We also, so that's on the consumer's end of that value chain. There's less mobility of people who are the market intermediaries, people who move product from producers to consumers. There may be higher costs. So for example, the consequence of COVID-19 restrictions and new safety precautions which are taken in say abattoirs and other places where food is processed drives higher cost. In Canada here, we're seeing that in the beef sector, where beef prices to consumers are higher, beef prices to producers are actually lower because of this higher cost that the processing sector is absorbing to do their activity. In other places, we see fewer market outlets for farmers. There's in places, say in India, where people from towns used to go out to collect food from the surplus supply during market days. There are more restrictions on that, and therefore lower outlets for farmers to sell their product. And then the market intermediaries themselves may be a source of COVID-19 risk. And we've seen that in the United States and Canada, especially in the meat processing industry. People think that might cause an overall sort of expedite a shift away from meat sources of protein toward plant sources of protein if people sort of see greater risks associated with their meat consumption. We also have reduced mobility of people who provide services, and that certainly early in the lockdown days, there was overall kind of worry about how we're going to get services to farmers. That has eased, quite a bit over time as the agriculture and food industries have been seen as essential services, and so trucking has pretty much continued for getting inputs to farmers, so that's been less of a worry than we initially had. but still an extra cost, and still in some places a real problem. Workers is really, a really fascinating thing with food and agriculture. And we've seen here in Canada a reduction by, I think, about 25% of the number of people who came into Canada in 2020 to work, seasonal workers in, especially in the horticulture sectors in Southern Ontario and Quebec and British Columbia. Elsewhere in the world, mass layoffs of people, or in the formal sector, as well as loss of employment opportunities in the informal sector, being stranded in urban areas, poor health sector, dense conditions making COVID-19 precautions difficult, mass exodus of peoples from the cities, overwhelming, especially in May, overwhelming the ability of the transport sector to move people from on the roads or on the rail lines, to move people out, mass exodus of people on the roads and actually walking, millions of people walking back to rural areas where they felt that they would be less exposed and be able to work in the agriculture sector again. So that's a story which is really unfolding still. This is a nice, but sad BBC video, a 7-minute little documentary about that I'd urge you to watch. So you can really see just how severe some of these effects are in different parts of the world. And we do have at least one person in our class from India who we might give some testimony about what she's seen. So as a result of all this, we're thinking much more about resilience has come out, right? So how robust is our food system to these sort of changes, this disruption that we've had in all of these mobilities that really kind of changed the playing ground on which our food and agriculture works. In the United States, for example, things work pretty quickly. There was some evidence of lack of resilience in, say, some of the animal industries, and evidence of, say, disposing of milk, having to dump milk. There's some worries about that, but overall, I think that the analysts would say there's a pretty resilient system. We benefit from a pretty resilient system here in Canada, but we've learned some of the exposures, like the meat sector, for example. We still having outbreaks in this intensive system, where we really have relatively poor people, relatively low income, living in relatively cramped conditions who are exposed. So it's showing a vulnerability of our system. We've had lots of discussion about how could we be more resilient. Should we have more local food? Would that make us more resilient? Should we have smaller companies? Would that make us more resilient? I think that we'll really see that over time, and there's lots of interesting discussions I think we'll even have in our class. Okay, so that's about mobility, a big one. Income and purchasing power. We know quite a bit about this because we've actually probably gone through the worst quarter. The second and third quarters are probably the worst quarters for this. It is estimated by the International Food Policy Research Institute that for every 1% decrease in global economic output, 2 to 3% of people of the world's population are living in poverty. So if we have an increase in 1%, say, in global economic output, some people will move out of poverty. So if we have a contraction, we're going to have more people going into poverty, right? The International Monetary Fund says that global economic output growth was 3.2% in 2019, and in 2020 it contracted by 4.9%. So we just add those up, we could say there was a contraction by about 8.1% in global growth. If we took that multiplied by 2 or 3% for each 1%, that translated to something like 16.2% to 24.3% increase in the number of people living in poverty. So overnight, not overnight, but within a quarter, we've had swelling by about a fifth, an additional 20% or so people living in poverty at the global level. And that would translate in something like between 110 to 150 million extra poor people living on the planet. That really shapes food insecurity. So all of those people are less food secure. The communities in which they live are less food insecure. And as that happens, the rich maybe stay food secure. More and more and more people and more poor people are vulnerable. So we're getting this gap widening, especially for urban poor people and women. The sectors that have been most affected have been the service sector, so that especially the informal sector, but think about even in Canada here, the service sector like food servers or people who cut our hair, they were, the jobs disappeared overnight with lockdown. The manufacturing sector is kind of intermediate and less for the agriculture sector, partly because agriculture has been seen as an essential service. And so agriculture is carried on, and some parts of the food system have actually expanded that part of the food system that involves getting food to people to eat in their homes. We've seen also interesting things with in this case, the urban residents being more affected than rural residents in terms of availability of food, because we've continued to be able to produce food. So people who live closer to their food supply have been less affected than people who are living further away. So that's been interesting, where we've got these urban underemployed, and we see this exodus of people, say in India, of people moving out and kind of back to the rural area, really reversing, maybe, long-term reversing, a decade or so of urbanization and growth, now kind of a ruralization in some places. In some places, like in Canada, we've seen the government programs have been pretty effective at filling in the kind of income gaps, but there are real limits to that in many parts of the world. And even we're coming up against the limits for that here in Canada. So finally, the policy responses. So what is governments doing? I'm just going to take you through two things. Two things related to policy here. One is about food markets. An interesting thing, there's been lots of scrutiny about food markets, partly because of what we know or what is speculated about COVID-19 originating in a food market in Wuhan, where many live animals, both domestic animals and wild animals, and people were in close proximity, including, for example, cages of wild animals being next to cages or over top of even cages for domestic animals, which are being sold by people. So this was kind of really sort of an incubator for a zoonotic disease or zoonosis. So these are diseases which are transmitted between people and animals. The epidemiologists and entomologists tell us that's the main type of new diseases in our world, are these zoonotic diseases, where in the wild populations, there are thousands of viruses roaming around. It's a matter of a few of them get over to people. Very small number, but occasionally they do. And that number that are getting to people is increasing over time as we have more and more interfaces between wildlife and people, and wildlife and domestic animals, and those things sitting together. And so we think about things like deforestation trends, and we're going to study that later, that deforestation and fragmentation of forests is creating new interfaces for people and people, wildlife, and domestic animal interactions. So that extra scrutiny of our markets spilled over to people being wary of markets, including policymakers being wary of markets. And so places like Nigeria limited food markets. They said food markets are bad because there's this interaction between people, maybe wild animals and livestock. They're also bad because that's where people get together. They congregate in markets to buy their food. So what we should do is have fewer markets. That actually had the negative unintended consequence of actually making people go and congregate in the few hours when markets were open. Other places in Africa, for example, extended market times, and we see that even in Canada here, the big supermarkets extending their hours and for example, having extra hours for seniors to give them a chance to do their shopping in less crowded situations. So it's been interesting how that's played out in different places. Certainly the extended hour approach for most places was a better approach to this than the limiting and reducing hours. The other thing, some other consequences of reducing hours was this congestion, but also really heightening and worsening food insecurity problems by making it more expensive and harder to do market interactions. The second thing, and this will be my last point in this relating to policy, but also the last point for the lecture, is about international trade. We saw in the 2007 to 2009 food crises, many countries really imposed a lot of restrictions on their food exports. They said, whatever food we have, we need to keep for ourselves. We're going to give up the income from international trade for this time. This is critical that we keep our food for ourselves. Global food stocks were, as I said, were at an all-time low. Fortunately, global food stocks, at least of staple foods, are an all-time high. So where there really wasn't the same temptation this time to what they call to impose restrictions on exports. There was a big threat, and Jill Hobbs, I'm going to talk about this a bit, is an ag economist at the University of Saskatchewan, talked about the problem of thicker borders. And certainly there have been thicker borders. It's been harder for people, say, moving food from Uganda to Kenya in East Africa. It's harder for market traders to go across the border because of COVID-19 restrictions. So there are thicker borders. Food markets are higher cost to actually just run the markets because of those restrictions. But the worst ones of actually just closing borders has been avoided much better this time than in 2007, 2008. The International Food Policy Research Institute, IFPRI, has been keeping track this time about how did countries respond, sending the signal that food restrictions were likely to make the total problems worse, right? So if, say, Kazakhstan's reliant on Russia for food imports, and then suddenly Russia closes that border, the people of Kazakhstan are going to be worse off. The food providers in Russia may actually be worse off. The rest of the world may say, hey, Russia's a bad partner, and actually not allow their countries to trade with Russia. So you get this kind of contagion that affects that. So IFPRI's been vocal and consistent over time of urging avoidance of that. As of today, they record 24 restrictions that have been put in place since the start of COVID in about 25 countries. So that's out of about 190 countries in the world. West Asia, Eastern Europe have been most affected, have been most involved in putting on restrictions, and they've also been most affected by the restrictions. So they've been trying to do something for their people. The overall effect is their people have suffered. Okay, I'm just going to end here by saying here are a couple sources that if you're interested in this for follow-up. Something that just came out, I think yesterday, was this book by Swidden. It's actually not Swidden, it's Swinnen. Swinnen and McDermott, 2020 COVID-19 and Global Food Security. I'm just going to change that. That takes a big global picture of what's going on. There's also this special issue of the Canadian Journal of Agricultural Economics that dealt with COVID-19 and kind of predicting what the effects would be. That was released back in, I think, April or sort of early May, and then a couple other papers. So that's it for this lecture. We'll come back early next week with the next lecture in this series. I'm going to stop sharing and then stop recording.